My name is Donna Setzer. I'm with the Southeastern National TB Center, and with me is Maria Lasley. And the two of us are hosting as part of the NTNC Centers of Excellence webinars that we put on from time to time. And today's session is titled TB Tools from the Field. And we are excited to share with you over the next hour and 15 minutes many things that are going on right here in the field, and we think you'd be interested and want to get involved. So with that, Maria, I'm going to turn it over to you.
Thank you, Donna. Everyone, thank you for being here, and all of your speakers, thank you for sharing your tools. It's kind of interesting how this came about through our interneting and talking to each other. We share these tools with each other, and then they become so helpful that we're like, listen, would you like to present this tool to many other folks who could really use this information? And so this is how this kind of got created. So I'm going to introduce each group as they present. And again, just thank you guys so much for helping us with this. And I think Diana and Nadia are also on with the Nurses Coalition. And I know they like to plug every once in a while. They like to plug if you all are interested in joining the Nurses Coalition. So with further ado, I'm going to introduce the Florida group, and they will be discussing what is TB Jeopardy. And I think Amy is going to start with sharing her screen, and you will have Jennifer Greenlee and Sherry Arwine from Florida. And I am going to turn it over to them.
Hello, this is Amy Hopkins. I'm a nurse practitioner in the Hillsborough County of Florida. And earlier this year during World TB Day, or a bit before that, my boss asked me to come up with something that would be in recognition of World TB Day. And I thought maybe I would do something interactive, a little bit fun, something that was more lighthearted, and came up with a TB Jeopardy game. And so we had folks locally play along and went through the whole game. And then we went on to share with all of our counties in the state of Florida. And then Maria asked if we would share here today. So the game is like typical Jeopardy. The answer will come up on the screen, and you will actually answer in the form of a question. So for example, if what is written is zebra colors, the answer would be, what are black and white? And the way we're going to keep track of this, we'll do as many as we can, but the way we're going to keep track of it is you would raise your hand. So down on the bottom of your screen, you should see a hand raise tool. The first person who raises their hand and would like to try to answer, Sherry or Jennifer will call on, and you'll need to remember to unmute yourself, give the answer, and then mute again. And then lower your hand, we'll go on to the next one. Actually, if you answer the question correctly, you'll be the person picking the next question. So we have topics are medications used for active TB disease, medication potential side effects, presenting symptoms of active TB disease, risk factors, and time-sensitive material. So Sherry, where do you think I should go first?
Let's do medications used for active TB disease, maybe 300?
300, all right. When taken during the intensive phase, this medication will shorten the length of therapy from 9 to 6 months.
Forgive me for the pronunciation, but is it Shetu?
Yes, it is Shetu.
Oh, yay, okay.
What is pyrazinamide?
That is correct.
Good job.
Oops, I gotta go back. Sorry, I went back. Okay. So then you'll lower your hands and then Shay 2 can choose the next question.
Same category, 400.
This is the oldest medication still given as a first-line therapy if not known to be resistant.
It looks like Heather is our first hand raise.
I think actually there was another one that popped up. I think Heather's was left still raised from the last question.
Oh, okay. Yeah, we have to remember to lower our hands from the last question.
And I was trying to catch the name, but it looked like the person had immediately put their hand
Their
down.
hand down.
Is my
And
hand still up? I didn't
Amber's
know.
hand,
Amber.
Amber's hand just went up.
Pulley now. So we'll go ahead and give this one to Amber Pulley. Oh, actually, I think it was Rebecca Muniz that had, and I may have butchered your name, so I apologize, that had the hand up first behind Heather in the last round. So do you want to pass it to Rebecca Muniz?
INH.
That is correct. All right, Rebecca, you get to choose where we go next.
Rebecca, just remember to put your hand down. There you go.
Medication potential side effects.
For how
200.
much? 200. These are potential skin changes. Anybody want to take a jab?
Diana Charles. Diana, you're on mute if you're talking.
There you go.
Rash.
Yes, what are hives, itchy skin, or a rash? You got it. So Diana gets to choose the next.
We'll go with medication, potential side effects for 300.
All right. These are potential gastrointestinal changes.
Oh, Rebecca, that was speedy.
Nausea.
What are nausea, vomiting, or abdominal pain? That is correct. All right, Rebecca, where to?
Presenting symptoms of active TB disease for 200.
This is blood-tinged sputum.
Flavia Martin.
What is hemoptysis?
Bingo. What is hemoptysis?
job.
Good job. All right, Flavia gets to go.
What are risk factors for 300?
300. Okay. These drugs suppress the immune system and are used to reduce inflammation.
Oh, Nadia, it looks like.
TNF alpha inhibitors.
Well, in this case, we were looking for steroids.
Okay.
So the last person who chose correctly, I think it was Rebecca. Where should we go next? We're buzzing right along here. We might even get through it.
Risk factors 400.
Having this chronic condition increase the risk of developing active TB disease by 30%.
Jessica Linsmeyer.
What is diabetes?
Yes, it is diabetes.
Okay. I mean, we can do risk factors for 500.
Okay. These people were not born in the US.
Nadia.
Non-US born.
Yeah. What are foreign born? It's kind of a trick question. All right, Nadia, where to?
Medical potential side effects for 400.
400. This is a potential joint manifestation.
Nadia.
What is gout?
What are gout-like symptoms? Correct. Rocking and rolling. All right, Nadia, where to?
Side effects for 500?
These are signs of hepatotoxicity.
Jessica.
Jaundice, dark colored urine, that sort of thing. And then, yeah,
Yep.
abdominal pain, loss of
What are
appetite.
anorexia, abdominal pain, and jaundice? All right, where to?
Medications used to treat or for active TB disease for 500.
This is the vitamin given to reduce potential side effects.
Diana Charles, firsthand.
B6.
Bingo. B6.
Lots of people know that one.
Maybe that one
I think we're
shouldn't have
getting
been.
competitive. No, we're getting competitive now.
All right. Where should we go?
Sorry. Risk factors for 200.
Oh, I'm sorry. Risk factors. There we are. Okay. Co-infection with this virus poses the highest risk of developing active TB disease.
Donna Johnson.
What is HIV?
She got it.
That message is clear to a lot of people. Good job.
All right, Donna, where should we go?
Time sensitive for 300.
Okay. The intensive phase of therapy lasts this long.
Carolee Asher.
8 weeks.
Yep. What is 2 months? There you have it. Okay, you get to choose.
Let's do medications used in active TB for 100.
Okay. This medication turns your urine orange or red.
Shirley Harris.
Just take your microphone off, Shirley.
Oh,
If you're unable to unmute, maybe you can put it in the chat.
in the
please.
chat. Yeah.
Then maybe move on to Diana in the interest of time.
Yeah.
All right. So, yeah, Diana.
I can't say it. Repent. All right.
Rifafifafiff.
Yeah.
What is rifampin?
And Shirley did put it in the chat as well. It just popped up.
I gotcha. Okay. All right, Shirley, you go ahead and, well, if you want to choose the next one, she would do it by chat, I guess.
Yeah, just put it in the chat. Medications for 200 for Shirley.
Okay. This medication reduces the risk of drug resistance.
Diana Charles.
Oh, I'm sorry. I didn't take my hand down.
Oh, okay. Shatu.
What is ethambutol?
That is correct. What is
Good
ethambutol?
job.
All right, where to next?
Oh, time sensitive 500.
And don't forget to put your hand down.
This is when recent contacts get the second QFT test.
Carolee Asher.
At least 8 weeks after their last exposure.
Bingo. What is 8 to 10 weeks from the last contact with infectious person? All right. So she gets to choose.
Time sensitive for 400.
Those with TB of the CNS, central nervous system, require treatment for this long.
Shatu.
What is 12 months?
Yes, it is. Boy, everybody really on the ball here.
I know, good job.
Okay.
Presenting symptoms for 500.
Don't forget to put your hand down.
These will make them shiver.
Karen Cusano. Don't forget to unmute, Karen.
She added in the chat, what is a fever?
What is a fever? Yep.
What are fever? Chills. Yes. All right,
You
Karen, where to? Risk factors for 100.
And there you go.
Someone in their household is an active case.
Jessica Linsmeyer.
What is a close contact?
Yes, what is a contact? Good deal. How are we doing on time?
It's only 11:15.
Okay, great.
We're doing good. It's 12:16, so you all have till 12:20, and then I have a great question to ask the group.
Okay.
Presenting symptoms for 300. Is that one left? Yeah.
Yep, it's there. These cause them to wake up in the middle of the night and their clothes and sheets are wet.
Shirley Harris.
Sweats.
She says, oh, sorry about that. Let me go back to, where was I at? Presenting symptoms for
300.
Yeah, okay.
She said,
Yes.
what are night sweats in the
Yep.
chat?
Perfect. What are night sweats? That is correct. All right, Shirley.
I accidentally muted you, Shirley. You should be able to talk now.
What is time sensitive for 200?
Okay.
Don't forget
Once
to
3
drop your hand
consecutive
down.
sputum smears are negative and at least 2 weeks of therapy is completed, this can be discontinued.
Jessica Linsmeyer.
What is isolation?
Yes.
But this is only the case in non-MDR TB.
That is correct. That's a good point to make.
Okay. Time sensitive for 100, please.
Culture confirmed cases must have treatment initiated within this many days to meet CDC requirements.
Karen Cusano.
7 days.
What is 3 days? She put in the chat.
Oh, yes, put in the chat.
We have 7 days. 3 days is ideal, but 7 days to meet CDC requirements. All right. Moving right along here, let's go to presenting symptoms of active TB for 400. Droplets spew from their mouth when they do this.
Diana Charles.
When they talk, sing, or anything like that. What is?
Oh my gosh, I went back. Where was it? Presenting symptoms for 400. Cough. Yeah, talk, sing, cough. All right. Diana, where to? We've got 2 left on the board.
Presenting symptoms for 100.
This will make their clothes loose.
Karen Cusano. What is weight loss in the chat?
Yes, bingo. What is unintentional weight loss? And then this one, medication potential side effects. These are potential vision changes.
Lori Leiser.
What is optic neuritis?
Oh, nice words. I said, what is unable to differentiate colors and reading becomes difficult. I think that counts. All right. Final Jeopardy. So this is the final Jeopardy that we have. We were able to get through the whole game. This famous person, known for having great legs and what's love got to do with it, was treated for latent tuberculosis.
Shirley Harris.
That would be Tina Turner.
That would be Tina Turner. Woohoo!
Oh,
We did it.
I did not know that. That's awesome.
Yep. Vivian Lee
cool.
too. She was one.
Oh, I'll be.
Yep.
Okay.
So that was our little game, just for the fun of it, icebreaker. And I hope you enjoyed it. Thanks
Yes.
for everyone who participated.
Yeah. I
And
would
there
say
are, go ahead, Sherry, go right ahead.
I would say we've used this in many different scenarios with TB Jeopardy. So we'll use it for nurse case management courses, and like our local health department just showed, they've used it for World TB Day activities. And it's something that everybody tends to grab onto and wants to share just for that engagement of staff. And it does get very competitive. So if you're doing it live in person,
Yes, it does.
courses, you want to make sure you designate some watchers for those hands that are going up. All right, thanks.
Thank you, guys. That was fun. You all can see this doesn't take long to move through. You guys are also smart. I wanted to ask, and you guys can put this in the chat if you would like, how would you possibly use this in your program? If you wanted to use this tool, how could you see this being used in your program? Rebecca says a great game. Somebody added Eleanor Roosevelt too, was one of the famous people. Pre and post training assessment. Oh yes, that's good. Staff training, team building. Yes, absolutely. Engagement.
Like that monthly updates, there's just some
Yes.
things need to be, reminded, or there's some changes going on. We all know about, the whole isolation and how that might be changing in your state, and making sure everyone's clear on any and all of those. It's wonderful. It was great to see so many of you participating.
Thank you, guys. Is there anyone that has any questions that you might want to ask Sherry, other than how might you get the tool? We'll share that information a little bit later toward the end of the program. Any questions
You
about
mentioned that they did Who Wants to Be a Millionaire. Some people might want to get a hold of that tool. That looks like fun
Oh
too.
gosh. Oh, I see that. Yeah. And you can modify the questions and the answers. Oh yeah. Karen's saying that's cool. Cool. Very good. Okay. No additional questions. So we can move on with our Illinois group. They have a data dashboard tool, which they have shared, that is awesome. Once you guys see that. And Sylvia Gendman, Griffin Shockley, Janine Sharaf, and Shatu Lamar. And I think it's going to be Janine sharing. And so if you guys would like to begin discussing your tool, I've seen it and it's fabulous. So I'll hush and let you guys proceed.
Sounds good. Thanks so much, Maria. Thank you everyone for letting us share our tool today. We are the Chicago Department of Public Health team here, and we are going to talk to you today about our TB information tracker, which we lovingly call the TBIT. Next slide, please. I thought this was a good overture to what we're going to talk to you about today. Necessity is the mother of invention. In our program, we're just dealing with so much, and I will tell you just more about that in a moment. But that's really what spawned creation of this tool, which we hope will be helpful for you here on this call, and of course to our team. Next slide, please. Speaking of the said challenges, we are a unique jurisdiction with a large TB burden in that we do not have our own TB clinics. As a result of budget cuts, they were closed in 2012, which means that we had to go to a delegate for clinical care for our patients, and that is Cook County Health's chest clinic. So we work with them. They're spectacular. We also provide transportation, especially for patients with active TB who need it, to chest clinics. So this is just to illustrate some of the time constraints that we're already dealing with here in Chicago. And of course, preaching to the choir on this call, our nurses team is saturated, as I'm sure many of you can appreciate from your own experience. We of course connect with patients to collect sputa, deliver medications, perform DOT and VDOT. We also dispense medications from our own stock. Our nurses do that. And also our nurses order anti-TB medications from our partner's chest clinic pharmacy. We also have to do so much more to coordinate care. For example, we have to get chest x-rays before our patient's first chest clinic visit. So that means we have to work with hospitals, providers, and it's just a lot of time. And there's so much more to this. But we also, in the recent years, had additional challenges to mitigate. We have an increase in TB cases, and I will speak to more of that in a little bit. And we are also significantly understaffed. Actually, our team usually numbers 5 from our nurses, a supervisor, and 4 public health nurse 2s. We currently have 2 public health nurses hired for full-time positions and 1 nurse within a temporary position. But as you can imagine, when we're dealing with so much, that is very significant understaffing indeed. And hiring takes a long time. On average in CDPH, it could take up to 182 days to hire new staff, but with us, it's been taking longer as we find that we try to get competitive, with some of the hiring that we can do. Nurses are in demand right now, which is great, but it's been difficult to get individuals to apply and accept offers from our program. Additionally, we had a contract we could not renew with a pretty key partner for housing. So any individuals who are experiencing unstable housing or homelessness, we could refer to this partner who also provided case management services and DOT. So they could not renew their contract this year, and our nurses consequently have to mitigate all the more challenges to keep our patients in care. Our patient information tracking is still mostly done on paper charts, and we also have multiple spreadsheets, which is, of course, a problem when you're trying to find information, especially quickly. Our state surveillance system is undergoing an update. Also, we have a surveillance system as a bureau, as a syndemic bureau here in Chicago, but we do not have data entry operators. So updating to the new surveillance system, as well as considering whether this bureau system, Maven, is right for us, has been just an additional tension and pressure for our team. So long story short, our staff are required to accomplish many tasks in a short amount of time, especially our nurses. Next slide, please. And speaking of increases in cases, I bet some of you are wondering, well, what does that mean in Chicago? In 2023, we experienced a 39% increase in our cases, which marks the highest number of confirmed cases in Chicago since 2011. That's significant for us. Next slide, please. And here, we also wanted to illustrate more of how our cases have looked over the years, but also just to mention some additional pressures, and specifically as related to our CDC funding, which, as you can see, has been decreasing. That's the line in the blue. As many of you I'm sure to know, the CDC funding formula was fully implemented in 2017, and it is mostly contingent on active cases, as you will see here in the red. But that doesn't fully illustrate our work. We're, of course, also investigating contacts, which you will see here in yellow. We have our TB suspects who are ruled out as not having TB, which you will see in the pink. And of course, our refugee immigrant patients new to Chicago, for example, B1, B2 visa holders. So we are operating at about 76%, or we were, of our 2009 cases in 2003, but we had less than half of the award. And this is, by the way, not adjusted for inflation. And before this graph was, or after this graph was created, our award was further cut by 2% mid-year this year in 2024. Next slide, please. And so all of these resource constraints, these timing constraints required a creative solution. And so our team created this calculator and tracker to help nurses with case management, as they were really bearing some of the biggest pressures in our program. This tool is meant to help their work be more efficient by automating some tasks. Also to decrease decision fatigue and work fatigue by taking some of these rote calculations off their plates. We also created it to provide automated reminders, which we hope are helpful. And also we're hoping that this makes collaboration in our program much easier, as other staff members can view the tracker and can perhaps help with some tasks such as sputum collection kits without even being prompted to do so. Our tool is Excel-based. As mentioned, it automates calculations specifically as related to sputum collection dates and medication delivery dates. As I mentioned, that's something important that our nurses do. Our reminders are meant to be at a glance. So you log in, you see a certain color, and your eyes are drawn to that, which hopefully makes the whole screen a little easier to navigate. But it is limited, our tool, to the quality of the data that is plugged in. So we have to make sure we're staying accurate with that. And also it just takes a human to analyze and make sure that everything makes sense. Does it make sense to collect sputum at this time? We are still in the process of implementation, just as an FYI, and we are continuously making improvements. So Janine Griffin will speak to that a little more later, but next I will hand it over to Janine Griffin to share more about our tool.
Yes, thank you, Sylvia. So now that Sylvia has given us a little bit more of the background of our program and this tool, Griffin and I are going to go into some demonstrations with the actual tool. So first, there's 5 main components to our tool in the form of Excel tabs. There's a sputum collection tab, a medications tab, medication refill request tab, DOT tab, and an appointments tab. Some other features of the tool are that there are formulas that are locked to maintain the automation of the tool. There's also the ability to add contacts for each patient. There's also a key on each tab that notes important patient details for that specific tab. And the patient column is locked when scrolling across the tool for ease of view. All right, so this is the sputum collection tab, and some main features on this tab are the treatment start date, the 30 and 60-day sputum collection dates, as well as the date to prepare sputum requisition forms. So this is what an average tab looks like on our tool. And as you can see in that bottom left, there's a key that notes what the color coding means. And this is currently the patient view, but if we wanted to look at the contacts as well, we'd click that little 2 in the top left. But for now, we'll just focus on the patient view. And we'll focus specifically on patient Watermelon Wilson. So Watermelon Wilson is a patient that started treatment on July 1st of this year. And Watermelon Wilson got drug susceptibility testing on the 12th. And let's pretend we got those results back and Watermelon Wilson is pan susceptible. We also know that Watermelon Wilson is a pulmonary case of TB, so we're going to want to collect sputum. So since we know that, we're going to type collect sputum, and it will auto-populate that first sputum set dates. So we know that from July 31st through August 2nd, we're going to want to collect that first set, which is the 30-day after treatment start date set. And we also want to prepare our requisition forms to send with the sputum to the lab about a week in advance. So after that first set is collected, maybe we have the lab results back, maybe not, but we're going to type no, the patient hasn't converted, and that will indicate that we want to collect that second set, which is that 60-day after treatment start date set. And as you can see, it'll populate from August 30th to September 1st. We're going to want to collect that second set.
Now I will go over 2 other tabs in our TBIT, the medications and the medication refill request tabs. The main features of this tab include the patient demographics, such as the MRN, birth date, and address, the date therapy started, the 60 days from therapy start, the last medication order date, which auto-populates the next medication order date, as well as details related to the medication regimen. We also have the refill request form here, which is auto-populated based on the information from our medications tab. So, looking at our patient, again, Watermelon Wilson there. Let's say that the last time we prepared medications for the patient was on June 25th. This will flag us that we need to prepare medications on July 18th, and they will populate into our refill request form here. So this is within, or it's about 24 days after the last time we prepared medication. So about a week in advance of that month due date. And this will, auto-populate onto our refill request form to be sent either to a partner pharmacy or for the own program to dispense medications themselves. The last two tabs in our tool are the DOT tab and the appointments tab. The DOT tab features the total cumulative doses to date, the goal doses, the treatment progress, and the adherence, which are calculated. These specific calculations are auto-populated based on the monthly DOT count. So we want to make sure that we are putting in the treatment progress every month. So once again, focused on our patient Watermelon Wilson here. Let's say that this month in July, Watermelon Wilson has completed 11 doses of DOT. You will see that it will auto-populate there in the DOT tab to show that overall, the total cumulative doses to date is now 11. And the goal doses, 11, the goal doses being 182, it will populate the treatment progress as about 6% so far, and the adherence, of course, is 100%. And then we also have the appointments tab, which just has some information for the nurse case managers to have all patient info in one spot. So we've got the patient and provider info, transportation if we are going to be transporting them to appointments, and any service requests that may need to be written for CDCIs or DISs or anyone else that may be working with these patients. So we have it auto-populated to say if Watermelon Wilson is going to need transportation, we'll type yes in there and it will flag us to write a service request for our CDCIs.
All right, so now that we've demonstrated what our tool can do, our goal is to have anybody who'd like to use the tool be able to access it. So once you receive the tool, we ask that you please fill out this feedback survey that we've created to help us make future improvements of the tool. If you could fill it out in the next few months, by end of October, that would be great, so you really have a chance to use the tool. And we also ask that if your perception of the tool has changed or you have any additional feedback, that you fill out the survey again and just let us know it's your second time. And we've also created a user guide to go along with the tool and help you get acquainted with it in the beginning. And both of these, the survey and the user guide, are included within the tool as separate tabs.
Thank you so much, everyone. And we just like to issue some acknowledgements as we wrap up. Of course, a big thank you to Dr. Kathy Ritger, who's taught so many of us on this call from Chicago about TB. Thank you, Dr. Ritger. Also, big thank you to our amazing program nurses, Sheitu Lemaire, Margaret Akadua, and Usagi Benosun, who are currently in the program and helped us with developing the tool. And also an important thank you to one of our public health nurses who worked with the program for a while, Vinand Van Heerden. Vinand, actually, I also want to say, passed away recently, but he touched our program and he touched the lives of so many people. And as we were developing the tool, I definitely had a vision of him tapping the calendar, whereas there were so many taps already on each day. So thank you to Vinand also for the inspiration that he's provided to our team. And thank you to all of you for listening. We hope that this tool can be helpful to you also. Please don't hesitate to reach out to us should questions come up. And again, thank you to our team for compiling a helpful guide to make sure that it's easy on the users. Thank you.
What a great presentation. Yeah, no, is there anyone that has any questions? We have a couple of minutes if anyone wants to put a question in the chat or if they want to unmute and ask their question to the Illinois team.
And we also have one of our nurses, so in case anyone wants the nurse perspective, Sheitu's here to share.
What a fabulous tool to remind you when to collect those sputums and let you know that they got collected. You know, how many times do we go to the home and we collect them and then we don't know if we actually, they actually got back to us. All right, it says, will this training be recorded? Yeah, Donna already is on that. Yes.
Hey, I posted a question. Where are you storing
Sure.
this tool and the data so that all of you in your program are able to access it?
So our program has
there it is. Yeah.
it's an Excel based tool. So at this time, every nurse has their own Excel tracker that's customized for their patient list. And then with our program, we have an if you will, like a drive, kind of an intranet, if you will, that is HIPAA compliant, and every nurse has their own folder in there. So every nurse has would have the tracker or has the tracker in their own specific nurse folder shared on this drive, which can only be accessed by our nurses. So that's immediately where we're storing it, and we're still working out historically what this will look like how many patients do you keep in there? When do you remove someone? So those are still questions that are kind of subjective and that the program is figuring out. But Janine Griffin Shatu, feel free to chime in here. Otherwise, we too would love to hear from all of you once you start using it, what your best practices are.
Yes, and in terms of access, as Sylvia mentioned, we have a drive that's HIPAA compliant that we're all able to access. And although every nurse has their own PowerPoint, not PowerPoint, Excel sheet, the tool basically, although each nurse has their own list of patients, we are able to go through our common drive that we share for patients and access the other nurses' Excel sheet, not to make any modifications, but just to be able to view the information. Should, say, a nurse be off and the patient needs some care, and we can access and see the information that we need in order to take care of that patient until their nurse gets back to work.
All right, are there any more questions? What a fabulous job. Thank you guys for presenting this. And I have a feeling there are going to be a lot of people using this tool. So if you have anything additional that you want to ask, we will be glad. You can put it on our chat, or you can send it to us in our SNTC. I'm going to introduce Heather Manrique. She has a patient treatment notebook and a resource from the Louisiana Department of Public Health. And we got to meet her back in Virginia, and she got to present this tool there a little bit. And we got asked about it a lot. And so with further ado, we asked her to speak on our presentation so you guys could have more interest in this. And we found out it's a very popular tool with one of our requests. So Heather, if you'd like to proceed.
Hello, everyone. I am so happy to be here with everyone. Let me just go ahead and share my screen. Let's see. Can everyone see that? Okay. So my name is Heather Manrique. I've worked in TB for over 21 years. I was a DIS and then a regional program manager. And a couple of years ago, we created my new position that's called Patient Advocacy Coordinator, because we really saw the need for patients to have a more positive experience during their treatment and to really get some autonomy and have a say, be part of the process rather than just being told what to do, and actually have some of their own opinions about how it's all going to roll out. So we started this position and just kind of have been building it from the ground up, and it's been really fun and challenging. And so I was asked just to show some of our tools that we've created for it. So basically, I'm going to show you the tools. We have some for training, collaboration, access to the tools, and a real-time assist. So I'll go ahead. I know I only have 15 minutes. So the training we have, which is really exciting, and we will get to the patient notebook, I promise. But we have this training, and we call it the TB e-learning center. And while the more advanced stages of it are still rolling out, it has a progressive learning platform where like domain 1 is TB 101. And as you get more into the job, you're able to do more training. And we definitely have trauma-informed care training, and some of those things come later on. So that e-learning center is something we're really proud of. And then Angela Blanchard is creating one that's specifically for nurses right alongside it. So we're really excited about that. We have in-person, just-in-time training, and then we have a whole bunch of stuff that we can do online. If any of you want to scan that QR code, you can actually see one of the videos that SNTC is hosting for us. And it's something, if you put that code on, a poster, and we put in ERs and other places that clinicians would be, and the clinicians can click on that QR code, and it's a video made just for them to be able to explain how important it is to think about TB when they're making these diagnoses. So a lot of our stuff is linked up like that with QR codes where you can just, in the waiting rooms, and this one is in particular for clinicians. So you're welcome to scan that. And like I said, the TB e-learning center, it's a hub for our TB training. It's intended for disease intervention specialists, public health nurses, and any other healthcare professionals working in TB. It's the TB, we call it the Tuberculosis e-learning center plus, because it has an extra element that includes in-person training, field experience, hand-on experience, trauma-informed care. We even have training about human trafficking and how it relates to TB. And so it's just a really global perspective of everything TB. Collaboration is really important, and it's something that my position I've really tried to focus on. So we're looking first at the patient needs. We're providing trauma-informed care. And while doing that, it's really helped reduce non-adherence to treatment and, appointments. The nurses, DIS, clerks, lab, and admin all work together for the common goal of that excellent patient care. But I also want to mention that one of the first things I did was I did a healthcare professional survey to see what the nurses, what the DIS, what they wanted and what would make them happier in their work. Because of course, if we don't have them, then we have nothing. So it's really been important to me to see about them and make sure that they are also having a positive experience during this TB process. This is my little baby, and I'm going to be doing a new one this next year, but this was the first one. It's called the Patient Treatment Notebook. We have it in Spanish and in Vietnamese and in English. If you scan that QR code or just take a picture for later or whatever, it has a little video with instructions of how to use it. And so we gave that to our nurses so that they can understand, and to our DIS. Basically, this is what it looks like. We have this little plastic cover to protect it. And it's given to, at this point, it's given to all of our cases and suspects when they first start care. And they can either take it with them or the nurse can hold it and they can work on it together every time they come in. The ideal is that they keep it with them because it's packed full of information. These are all the pages in it. And so we have, a table of contents. I know you guys can't see really the details of this, but it has the health unit phone number, and the only identifiable information, it has the patient's electronic health record number, but not their name. So if they were to get it lost, there is on the back of it, way down here, it shows how to return it to us, but it would not be identifiable as one of our patients. It has place to put the nurse's name, the DIS name and number. And then the first parts of it are just talking about TB. The basics, being infected, having active disease. Over here, it talks about the different kind of masks. So they know the difference between the N95 and the surgical mask. Talks about symptoms, why the treatment is so important, what DOT is, what a DIS is. And then it goes into, we're so used to just, come in for your blood work and we're testing AST and ALT and bilirubin and creatinine and all that. And our patients don't really know why. And so this breaks it down and actually explains to them each of the tests that we're doing for them and why we're doing them on a monthly basis to make sure that their health is staying good and that the medicines aren't affecting them at all. We also talk about the different tests that we do, like sputum collection, and we explain what the 1, 2, 3, 4, all those different smear results mean. And so it gives them an idea of exactly what, because they know they're chunking up stuff and they know we're sending out for testing, but they're not really, a lot of them aren't really quite sure what that all means. They wait for us to tell them whether they're infectious or not, but we really want them to understand, at least on a basic level, what they're going through, because this is their health. We have a medication page so they can circle the medications they're on. For an actual dosage information, we wouldn't want to put it here. They would need to, request the medical record. But this, if they go to their doctor's appointments, they can at least let them know, hey, these are the other medications I'm taking. And then if you go over here, this is an area where they can keep track of their health unit appointments. And what we do is, for each appointment that they keep, we have Visa cards that are $25 each. So we can give them Visa cards for keeping those appointments. And they can keep track of all that. And then over here, this is for test results. So when they come in every month, the nurse and the patient can together write their results for the AST and ALT and all the other blood work, and they can talk about it. So, your AST was 32. That looks great. Your liver's doing fine. And then also the sputum results. They can watch how they're going to have a 4+, and they're going to be able to watch as it gets better and better and actually see that progress and feel the sense of accomplishment as we do. As we see them getting better, they're going to be able to feel that same accomplishment. At this back part is an area to attach resources. So depending on where the patient lives, I print out and supply to the nurses in DIS a resource list in case the patient needs, resources for food or housing or anything like that. They'll have those numbers in there. And of course, if they can't read or don't have access to internet, then they can let the DIS know and we can help them get all that together. So this is just some more page of what it looks like. All the little dorky drawings are from me. If you want to have a complete copy of the book, the notebook, it's available here. That's the code. That's the actual, it's into my Dropbox. You can scan the QR code, or you can just copy that, that URL. And a lot of states have requested it. And I want it out there. I want to help the patient. So if you want to copy it down, you can adjust it for your own state. On the back, it shows how much money we paid to have it printed. So you can see in terms of just guessing how much you would need to pay. But you can also just print it and staple it together. I mean, it doesn't have to be a fancy plastic covered book. Okay. Another thing that we've done is we have what I call the tuberculosis health rides. So it worked out perfect. If there's the lift, but it just Uber had to be, because that way it worked with the tuberculosis. These are, we've set this all up. We are piloting it in 3 different regions, and they have free rides to and from TB related appointments. So we have coordinators, nurses and DIS can be coordinators. It's unlimited amount of coordinators. No one has to use their private cell number, none of the workers, and the patient doesn't even have to have a cell phone. So the coordinators will set up their rides, their pickup points, and then the DIS or the nurse can communicate with that patient to let them know where they'll be picked up. The billing goes straight to our central office, so there's no money exchanged. And we're just really excited about this. We just now added the 2 other regions. And so we're just, because, transportation is really rough. The only setback is that we can't, when they're still infectious, we can't obviously use it yet. But so we're not really sure what the solution to that part is yet. But you know, we do go out in the field if we need to, for like the nurses can. So that's really exciting. Now we also have some tools for the.
Hey, Heather, this is
Yeah.
Donna. If I can stop you just a second, because some people are asking questions specific.
Sure.
Okay. The Uber Health that you're using, they're asking if you work directly with Uber or how were you able to set that up?
Okay, so I went online and I Googled Uber Health rides. And after a long time, I found the person I needed to contact. I have her contact information if anyone needs it. And then she called me and I told her what our needs were and she helped me hook it up. And there was a process of, you know, getting our account approved up to a certain amount every month. And, you know, there was just just some paperwork and approvals needed, but she made it very easy. And then now, it's really it's a dashboard and you can go in and you can set up your rides. And so.
Right. And Uber Health is a program that Uber already runs.
Correct.
You were able to work with this individual who could understand your specific needs and help you make it work for you, right?
Correct.
Okay.
Correct. So, yeah. So you're welcome. So real quick, just a couple more things we have. Since I'm the patient advocacy coordinator, anytime a nurse or DIS or any other of our healthcare workers need help with a patient, maybe adherence, keeping appointments, not wanting to take their medicine, things like that, they can reach out to me and I can help them use critical thinking, really kind of work together to think of some solutions. We have this thing called the PAC action request, and it's this form right here. They can fill it out and just kind of let me know, hey, I'm having trouble with this. This is what we've tried so far. And that just kind of gets the ball rolling. They also have access to this. It's an action flow chart. So I'm going to show you real quick. I'm going to bring that over. Do you see this action flow chart? So if I open that up.
Yeah, we see your page that says Appendix 1.
Okay, good.
Okay.
So this is something that it's just a PowerPoint, but it's interactive. So, you know, let's say a patient didn't have transportation. And so it goes through all these steps and then you end up clicking transportation. And it just helps you get that critical thinking, because sometimes when you're in the middle of it, you just don't know how to help a patient. And so this just goes through all the steps with you and helps you find some solutions. And then like, if you need that action request, this is a sample, Bobby Heartgrape. But basically,
I'm not sure we're seeing that, Heather.
Do you see a form with highlighting on it?
Over on the left, and then on the right, we see Appendix 1 PAC action form flowchart. Yes. And down at the bottom, it says tools for HCPs.
Okay, let's see. Let's see. So you're just on this main page. It's not clicking through. Okay. So it might be
that screen separately.
Yeah, it may be that you have to actually be in it to be able to click on all the links, but it does, depending on which of these you click, it will take you to another flow chart that will help you answer questions. And depending on what those answers are, it'll guide you to solutions for that. That PAC action request form link is also here. So I wasn't sure if you'd be able to see it actually in motion, but yeah, because this won't work unless you do the actual slideshow. It's more of an editing thing. So anyway, that's just some of now this patient questionnaire to assess resources. I know you can barely see it, but this is what we give to all of our patients, our cases and suspects when they first come in, and then it gets sent to me, and it just asks them, you know, are you having trouble with food? Do you have reliable transportation and a place to stay? And just kind of gives us a screenshot of initially what kind of barriers they may be dealing with. emotionally and physically. And so that's given to the patient first and sent to me. And then everyone can follow up with this. And of course, I always just make myself available through my cell phone. They can call me or text me or email me, and we can discuss barriers. Now, tools for patients that we have, if you can feel free to scan that QR code. This is a QR code that we have in waiting rooms. And so the patients that are in the waiting rooms can click on that and learn the basics of what is TB. And it's just a little video I made that kind of goes through infection versus disease. We also have a lot of different posters in English and Spanish about TB disease, and then specifically trying to get people who were born in other countries, if they haven't gotten a T-spot yet, then they can read these and know that that's a conversation we can have with them, and they might qualify for free testing. And then the last thing is just that real-time assistance. You know, I'm always available. If I can't answer them right away, I will get to them as soon as possible. If you want my cell phone, you can email me, because since this might go out to a lot of people, just email me if you need any links to any of this, or you know, one of the QR codes isn't working or whatever, just let me know. And that's it. Did I use my 15
Heather,
minutes?
yeah, you did. And you have 5 more minutes for questions. And Heather, your drawings are not dorky. I love your drawings. And it's about the real world. So that's who we see. And if our children were to draw their family members, that's who they would draw. So and I just think this is a fabulous tool. And so I think Donna had put your email in there already. And I think you said that would be your preference if somebody wanted to reach out.
I did not put her email in there,
so
so she would. Yeah, I know people are looking for links or contact information, so that'd be great if you'll share that, please.
Do you want me to just put it in the chat? Okay.
Yeah, in the chat. Yeah. I thought I had seen it. I apologize.
Yeah.
What questions do you guys have for Heather? Yeah, this is an awesome tool, and there's so many other things in here that she didn't even get to mention. So when you guys do scan those QR codes, they are very helpful. And I think the more that you order, the cheaper the price gets down the road. So if you can,
I'm
go
sorry.
ahead.
And please,
No, go ahead.
If anyone decides to make one of these booklets for your state or your program, please share later, because this was the first one and I'm gathering information about how we can make it even better. I would love to see what everyone else comes up with. You know, it's not about who created it first or who made it first. It's about, are we really getting out there and helping our patients? So I would love for any of you to share with me also.
Especially if you do it in another language that Heather doesn't have. That was one of the requests when we were in Virginia. And Karen and Donna, you would have to help me remember some of the countries or the groups of folks that they were asking about when we were there. But so don't reinvent the wheel if you use another language that she's not used yet here. Heather, was there anything else that you wanted to add? There is your, okay. Oh, Heather, you're a star. You are a star. They're saying you're a star.
There's nothing else. I mean, I get really excited about it. I know I had wanted to show like in person, but evidently it's too little and you can't really see the book. But I just thank you for having me talk.
We appreciate it. Well, we have had a great day. I have enjoyed this. I loved the TB Jeopardy, you know. That's a great way to start a meeting. It's a great way to keep up education. And I think Donna mentioned that we have some new education items coming out, and that would be a great place to have people introduce that in a low stress environment. And then, gosh, the Illinois tool, I cannot say enough about that. And to know when you're supposed to do something and have those refills in there. If you guys are interested in that, you have the information to begin with that tool. And then, of course, you can reach out to Heather on her email about her advocacy tool. And there's a lot more in there once you start scanning that code that you'll see that she offers her folks, including but the Uber thing got a lot of attention there in Virginia. And people were able, I've known some people that were able to actually get funding for their programs to do that, instead of, giving the gas tokens or bus tokens and things that way. That way, that they're getting where they're supposed to get, and when they're coming, and there's documentation that they actually got dropped off at the clinic or wherever they were supposed to get dropped off at. So,
and the greatest part was that our
go ahead.
patients did not have to have a cell phone. They can
Yes.
they can work with a landline, or they can work with nothing. I mean, the patients can still get a ride.
Yeah, I
So
forgot about that. Yes, that is a great thing to point out. Is there I'm trying to watch the chat. Is there anything else that anybody else has a question about?
I had one.
Go right ahead.
Hi, this is actually for Heather. Heather, do you reach out to any of the correctional facilities when there's a transition into the TB programs?
Well, I don't personally, actually just wrote that down as something to look into. They do definitely reach out to our TB program in general, and we help them, transfer to our care and DOT and everything. But I did write that down, and that's a wonderful avenue that I need to explore. Thank you.
Oh, thank you, Heather. A great job. I love the illustrations. I think you get it from it's for both the kids and the adults both. So I think you did a really good job.
Well, thank you so much. I appreciate it.
Yes. All right. Donna, I cannot think of anything else.
Heather, get
I know.
Sue's name right there. She's a fabulous resource for corrections, and will connect you with other people also. So she's a great resource to start with.
She is a whiz at corrections. She actually came to Kentucky a long, long time ago when I was there and helped us out with an outbreak. So,
all right.
Gosh,
yeah, does anybody? What were the other languages, Heather? You we're being asked.
We're being
So,
asked.
The patient treatment notebook we have in Vietnamese and Spanish. So if anyone needs one of those links, they can just email me and I can provide them with that entire book also.
And then I think someone was going to work on a Ukraine version of that when we were in Virginia. And Karen will have to, and Donna would have to hold me to that. But I know there was some discussions of that. Let's see, any issues with the legal division approving the Uber Health? Amy Hill is asking, is there any issues with the legal division approving the Uber Health? Did you have any issues with that, trying to push it through?
It was actually amazingly easy. And I think it's because it wasn't just working with Uber and us trying to, like you said, invent the wheel. Like, they actually have this set up with a lot of hospitals already, and it's proven to be wonderful. They are adding more and more, which is, I think, Uber Health Assist, where they'll actually be able to carry like wheelchairs also. So that's down the line. And then another thing is they also have, like, if we wanted, we could have them also pick up groceries and take them to our patient. And also help with medication drop off and pick up. We're not doing either of those yet. We're still piling in the rides, but they do have those options open.
Imagine how that could free up your nursing staff and your
isn't that
DIS, to be able
Yeah.
to.
And the nurses, the nurses were trying to get an Uber ride on their own cell phones. And it's just, that's a hard thing to have to do. So, yeah. So anyone, if you can also email me, and I can give you all my contact at Uber. Her name's Natalie, and she's fabulous. So she can help you out.
And while we're at it, Heather, are you able to put any of the links in for the toolkit that's been requested a time or two here?
Okay, I will. Let's see.
And we'll stay on a few minutes as she puts those in. But
so all the videos, well, most of the videos are all on the SNTC site on their webinar YouTube. So you can go there for those. And then let's see. I will get these real quick. I have 1.5 million things open right now.
And if you can't get them right now, that's okay. You can send them to myself or Donna, and we can make sure that they get out there to
And
everyone.
I have no problem with sending them all to you, Maria or Donna, and having you guys just host them somewhere.
We could talk about that afterwards, but certainly as a follow-up, when the webinar is ready after the recording, we can do a follow-up here with any of these various links that people were requesting.
That would be great, because I want to make sure I don't just throw some links out there. I want to, I want to get it all together and send it nicely.
And Karen just sent the SNTC webinar for the YouTube.
Yeah, because
we are currently hosting all of Louisiana's videos that Heather was talking about. So you're welcome to go there and use those at any point.
So what I can do, this is going to be, didn't work. I'm trying to at least give you, wait, hold on. Hopefully this will work. It's not copying it though. Yeah, it's not wanting to let me pull stuff from my PowerPoint right now, so it would be really helpful if we could just send it to everyone after.
No problem. Well, it was great to see everybody. If there's no other questions or comments, we will call this a wrap for today, and thank you for joining.